Police are confirming people shot.
Who shot you? I don't know.
Tonight on Save My Life.
Tell me your name! Tell me your name!
Call the OR, we're going to the OR. If we don't find the bleeding and stop it, he's gonna die.
I have meatballs in my oven. She got food in the stove.
Boston police went up to a apartment and shut off the meatballs.
The meatballs in the oven.
Division 1 arriving.
Hi, team.
There was 6 minute ETA to the rooftop.
We don't know where the bullet is. Right now, the primary concern is stopping the bleeding and saving his life.
Units response to rollover.
He's alive.
Open your eyes.
Ambulance 4, Boston.
Ambulance 4.
A4, an injury 2. Police officer injured on the scene.
A4 en route. Agent officer.
We're responding up to Roxbury. The police called an officer in trouble. They have an out-of-control scene up there.
Scene is unsecure. Everybody can stay outside.
Vision 1 on Quincy. The report we have is that the officer inside has a leg injury and that the assailant that attacked him is now under arrest.
Under arrest, so shut the
How we going, man? You all right? Sorry for the rough carry down.
No, I appreciate it. You guys did what you could.
Looks like he has a dislocated knee. The police, when they get up there, they try to remove the person who was not supposed to be there.
We get there, mother wants her son to leave, she's choosing to leave.
So then the family then turned on the 2 officers that were there, so it was basically 12 on 2.
And the next thing you know, somebody came in and gave me a quick MMA-style kick to the leg, and I was just ripped down there.
Instantly dislocated his knee. As usual, things that seemed to be a regular mundane call for the police for removal just completely got out of control, and there was an officer injured. Boston has some rough neighborhoods.
Ambulance 15 and paramedic 1. Units respond to Main Street in Charlestown for shooting.
Paramedic 1A, possible second patient.
Police are confirming people shot.
Male, unconscious after single gunshot wound to the right. Flank area.
We got 2 victims.
Patient number 2, conscious and alert male. 3 gunshot wounds to be confined.
Division 1 arriving.
Hey, 1.
We have 1 patient in very bad shape. He's unconscious. The second patient with some less serious wounds.
One, two, three. Where'd she hit, Steve?
One on the butt, left down.
So they're both going to Mass General. Mass General.
We have 2 teenagers coming in, both have been shot.
We got the officer right here, right now. Is there something you need to say? You need to say it right now to this man here. Okay, Dave, who shot you?
I don't know. I was standing in front of the store, and next thing I know, I hear a couple pops. I just felt tingling.
Paramedic 1, how do you rate it?
Got 2 gunshot wounds coming in right now. One is all extremities, buttock, bicep, and hand. Yeah. That's the more stable one. The other one is going to be just 1 single to the flank, which is agonal, which I'm going to run. This is the single gunshot wound. He's been shot, it sounds like, to the chest, which is always extremely concerning. Not breathing very well. Is everybody in the room ready?
Please, 17. All we found is one single hole in the right side.
All right, can you tell me your name? Tell me your name. All right, if we can get an O2 set on him. He's got a not responding to painful stimuli. GCS less than 7. Let's get ready to intubate for airway protection.
This kid is from Charlestown. It's a very tight-knit community. They'll probably have a lot of family and friends showing up here at Mass General. It's going to be a tough night here.
Police officer, but he has a dislocated knee.
This house full of people.
Kicked me right in the side of the knee.
Gave you a donkey kick right to the knee.
He was in some sort of fight and got kicked.
We got you, Mike. We got you. There you go.
Do you have any neck pain at all?
No.
No? Any chest or belly pain?
No.
And the pain right now, is it like 10 out of 10 when we're down there touching it?
Absolutely.
Okay.
You dislocated your patella. It's actually
Fancy word for kneecap?
kneecap. Yeah. That was just literally, instead of being in the middle of his knee, was on the side.
We can give you some medicines, or I can put it in really quickly.
That sounds like it will hurt so bad. Don't want to sound like a wimp.
No, understandable. Yeah, you guys were witnesses. We'll give you some medicines, and then it literally takes 2 seconds to put it back in.
You just kind of straighten the leg and push to the medial aspect, and it goes right back in.
I've never actually reduced a patella before. There's always somebody supervising you if it's your first time.
So all you're going to do is straighten as much as you can, a little bit of downward pressure here to keep this stable, and just a little medial push.
Quick question.
Yes?
Sounds like it's your first time doing this.
I'm here for support,
Okay,
and it's super
just a
uncomplicated.
question. All right. No offense.
No problem. None taken. Sometimes patients, especially in teaching hospitals, you know, they kind of catch on, is this their first time, and they get a little hesitant. We're going on the count 3. You ready?
Ready.
1, 2, 3.
Yeah.
All in. Done.
Son of a gun.
That's it. You're all done.
It looks normal again.
Yeah, it was a satisfying clunk. Back in place, so yeah.
Are you feeling better?
Oh, yes.
Okay. Sorry to cause you some pain. So knee immobilizer x-ray, and then that's it.
Did it look as gross as it felt?
You did well, sir.
It was good for a first time.
Oh, thanks.
I was nervous because, I mean, obviously it's my leg, and I just wanted to make sure it's done right so I don't have any lingering effects from it, so I was a little bit concerned, but she did a good job. As soon as it was back in place, the pain started to go away immediately. It felt 1,000 times better.
So we got a 17-year-old guy found with a right gunshot wound to the right flank, found down in a ditch. Nothing on the back of the head.
We have a double shooting, 2 young men. One of them is awake and talking. The other one sounds like he's in pretty bad shape.
Nothing else in the right axilla. I do have bilateral breath sounds. I only have one wound onto the right lower lateral chest wall.
Torque abdomen. All right, x-rays on the way. Let's move.
I think our concern right now is where did that bullet go? Anything? Nothing in the groin? Right now we're having an arch chest x-ray and full x-rays actually to see if we can see where the bullet went.
I've got to go see this other patient, the other gunshot victim, and check in and see how he's doing.
Isn't the x-ray department? They're going to take a film?
He has 3 gunshot wounds, one through his left hand through and through, one through his right arm through and through, and then one through his left hip, through his left buttock cheek. So 3, 1,
Quick question
2,
for you.
3.
Yeah. Were you with that other patient who came in?
Yes, sir.
Did you happen to witness what happened?
I just heard a couple bangs. I felt a weird tingle.
Yep.
Hit the floor and just started rolling.
Okay, so you didn't see what happened to him? Okay.
No clue.
Thanks, Pete.
He's all right? You checked him out, too?
We are checking him out. I can't really tell you much more than that. So fortunately, it looks like he got pretty lucky and is pretty stable, but he's appropriately concerned about his friend.
I just told my buddy pulls through.
We're down to 69/42.
Go for the OR. Call the OR. We're going to the OR for exploration. I don't want to delay. I got lead on, so you just put the thing down and shoot around me.
We're losing a pulse.
They're taking this patient emergently to the operating room because he's so hypotensive. He's losing volume from somewhere. Blood probably into his belly from his gunshot wound. Don't know where it's coming from. Don't know where it's going. It looks like his family just arrived.
He's lost a lot of blood. His pressure's dropping. I can barely feel a pulse. We have to take him to the OR right away.
Mass General Hospital, Boston Ambulance 14 en route to your facility with a 14-month-old child. Respiratory distress due to anaphylaxis. ETA 5 minutes.
MGH Boston calling with a notification from Boston AA.
So we have a 14-month-old that's coming in with a severe allergic reaction to peanuts. Vomiting, swelling. So we'll see what we have.
Did you notice any rash on her, Mom?
Yes, on her face.
What's she reacting to? Peanut butter crackers. But she's had peanut butter before, so I didn't think it was going to be that serious. Oh, there's the vomiting.
She's vomiting, she's getting hives, she's getting swelling in her mouth. That's very concerning. That could turn bad very quickly. IV that if we need to give her other medicine.
Right.
I need to make sure it's good before I take it down. That's not good.
What? Oh, come on with this. No, hell no. Come on, man. I'm not going to argue with you, okay? I asked you to hold her arm properly. Come on, man, please. I told you. Is there another IV nurse? No, I need another IV nurse. There will be someone else. Hurry up, please. Hurry up, please.
Listen, we can do this every day.
I understand that I'm not saying she's doing a good job, but I'm letting you know my daughter's strength.
I don't even know that I would call requiring a few attempts to get an IV in a mistake. Sometimes you get lucky, you get it the first time. Sometimes it takes a couple tries.
Oh, my God.
If it takes a few more tries...
Listen, I don't want to hear that anymore, okay? You need to get someone that knows what they're doing, because they're not going to just keep sticking her and not get it right.
My son has a peanut allergy as well, and this happened to me when he was a little bit older than that, and it was one of the scariest moments of my life. And I felt for her, I didn't feel so much for her trauma. She was impeding my care of the patient.
How can you not hold her arm? I'm telling you to hold her tighter. And I'm not feeling it. I know there are IV nurses that are excellent. I know y'all got somebody.
I had to ignore her behavior for a minute and concentrate on the patient, because that's what's important. There we go. Perfect.
I know, right? I'm practically cussed you out. Now you're holding her too tight. Oh, I'm so sorry. I just can't deal with this.
Doing this here for quite a few years, and that was one of the toughest right there. Yeah.
Oh, she's okay now. Oh, say hi. Yeah.
Let's pick up the pace because I'm not really feeling a pulse right now.
17-year-old who was shot to the right side. Right now, we don't know the exact location of the bullet.
He's bleeding really badly, and if we don't find the bleeding and stop it, he's gonna die. We don't know where the bullet is. I did 3 x-rays. I don't know where it is, but there's a single bullet hole on the right side, and he's got blood coming out there. God, the heart is empty. All right, can I have something to cut the sternum with? We gotta find what's bleeding there and clamp it.
He's got lots of blood in his right chest.
Yeah. This lung is contused, you know? Clamp, I need the clamps, please. And you said the blood is here, yeah? Okay, so there's multiple holes in the lung here.
There's too many holes in the right lung. He is bleeding way too fast. He's losing air. The heart is unstable. We have to take out the lung in order to save his life.
Do you have a pressure?
Currently en route to your facility with a 19-year-old female pedestrian struck. Unknown loss of consciousness.
Team 1 with an EKG to the trauma room in 3 minutes, please.
We're gonna get a female pedestrian struck by a car.
This is a 19-year-old female who was struck by a car in front of Simmons College.
We're gonna take care of you, okay?
She has right hip pain and right side pain. She has lacerations on her left hand and also above her eyebrow on the right side.
You know how fast?
The friend said maybe like 40 miles per hour.
Abdomen does not have any signs of trauma.
Ow.
She's tender in the left.
Ow, no, please don't.
Left quadrant. Where's that hurt?
It just hurts like from like down here to up here.
Okay, can we get a fast exam?
Lift up your tongue for me. Thank you. Where's the tender, Jason, in the air?
She's tender. I'm not even touching you right now.
I know, it just hurts.
She has an abrasion over her right iliac crest.
Please, can you not touch it? Please.
Just doing an ultrasound of your belly. Make sure there's no bleeding in there, okay?
Okay, if you move any more to the right, it's gonna really hurt. So please, please, please tell me.
How old are you?
19. Is this your first year in college? This is my second year.
We just found out that the patient is a nursing student, although I don't think she planned on being a patient herself at any point.
Just gonna get an x-ray of your chest and pelvis, okay?
He's got a lung injury. We're just gonna lop it off, okay? Okay. You're gonna get the right lung. All right, here's the right lung. We're on single lung. Okay. All right. Blood pressure is fine.
Okay, clump is up. We are holding the pressure still.
All right, so we're back now. We're back in business. Let's get. Yeah. We got a rhythm. We got a pulse. Let's go. I like it. Woo! I'm not gonna celebrate just yet, but he's alive. Thanks to you guys. Thank you very much. Everything that was damaged has been repaired, and I'm happy for that. But I'm still very realistic and guarded. We still need to get a CAT scan of the brain to rule out a traumatic brain injury, and I still have no idea where the bullet is.
2 people to find help in ED X-ray, please.
Otherwise healthy young lady who was crossing the street and got hit by a car. Do you remember what happened?
I mean, I remember getting hit, and then I just found myself in the street, and I was just like, did I get hit by a car? And then
So you lost consciousness?
So I guess, but only for a few seconds.
Okay, yeah. Scan? I would say that's negative. Yeah. We ruled out internal injuries. We're worried about brain injury, given that she fell and hit her head.
1, 2, 3, 4.
She has no blood in her brain, and we've ruled out a neck fracture, and those were the main things that we were worried about.
I love you.
I love you, too.
Some of the patient's friends from nursing school just showed up. They were with her at the time of the accident and saw the driver, and we just found out that the driver is a nurse as well.
They stopped the car?
Yeah.
It was RN.
Oh my God. She was leaving work. She had like her little badges on and everything. She knew what to do because clearly none of us did. I mean, granted, we're 99% of us are nursing students.
I realize that nurses are supposed to make you feel better, and that's really what we aim for, and not to be hitting people with cars.
You look pretty good for someone who just got hit by a car.
Do you remember the guy that was riding a bike, ripped his helmet off, and he came running over? What? Should have given him your number.
Damn.
That's how you get the boys.
Get hit by a car.
The young man who was shot in the chest and we stabilized him in surgery is still very critical, but I still have no idea where the bullet is. So we came here to scan his body, and we discovered that the bullet is actually lodged in his brain. So that's very bad. It's in a part of the brain that's very important. And we have no idea how much brain function he still has. We just called the neurosurgeon, and we're going to go in and see the family and kind of tell them the news and what to expect.
I won't be able to handle it if something happens. This is the doctor's.
I have some updates for you.
Paramedic 2, ambulance 3, motorcyclist down, struck by a car.
Paramedic 2, Roger, responding.
We're responding right now for a motorcycle versus a car. And unfortunately, motorcycles never win against cars. It's the motorcycle.
What are you doing? Stop moving.
Willie, you're killing me here. What are you doing?
It's too tight. Give me a motor. 1, 2, 3. My neck.
Let's get you in the truck, okay? How old are you?
39.
Okay. Even though there's no outsides of trauma, he very well could have broken bones, he could have internal bleeding, so it's very imperative that we get him down to the emergency room right away.
I was in the bike lane. This dude cut me off. He was doing like 90.
Willie, your full name, please.
Willie Hamilton Jr., and I'm a rapper. My stage name is Doug. That's what the world knows me by. I need some water. Give me some water.
We can't give you any water right now.
Why not?
Because we don't have any.
What do you mean you ain't got water in the ambulance? That's impossible.
We do not carry water.
Well, give me a Motrin. My son, I know you got a hospital.
We don't carry that either.
It's crazy. Get me there quickly, and I need to go to the hospital fast.
That we can do.
Hi, Columba.
So EMS called, and it's a motorcycle accident, and the man's awake, but we're not really sure the extent of his injuries, so we'll see when he comes in.
All right, couple of bumps coming out, okay? 1, 2, 3. There it is.
Haven't dropped anybody tonight.
It hurts me to my heart when I hear a kid get shot. That little kid that should have been a doctor probably would have helped you when that person popped you. That's why I'm saying this to let the kids know. That's your boy Doug.
It is mic drop.
Now on News Center 5. Breaking in Charlestown tonight, the hunt for a gunman after 2 people are shot. Right now, a big crime scene is set up on Main Street. 2 men are at Mass General with gunshot wounds. No arrests have been reported.
So that young man that was shot in the chest, he's still really critical. His remaining lung is not happy right now, and so we're having difficulty providing enough oxygen to it, which is definitely not helping his brain injury. He's critically ill, and he's very much deep in the woods. It's really challenging. It's very difficult to break bad news to families. So we got back from the CAT scan, and I told you that I was concerned that he had a brain injury.
Does he?
I also mentioned that I didn't know where the bullet was earlier. We looked everywhere for it, except for the brain.
It's in his head?
Yes. It's not clear how much damage has already been done by the bullet along its path to get to where it is right now. It's lodged very deep in the brain.
So are we still moving forward, keeping him alive?
Absolutely.
Right?
Yes. Yeah, well, we're still doing our best to keep him alive. His lung function is slightly worse, and we're taking some even more drastic measures to keep him afloat, which is that we've had to flip him over so that he's face down now, and we've started a new strong medicine to help his lungs aerate.
How much longer does he have?
Impossible to say. I don't know. He's very sick.
Do you think he has a younger sister? Do you think that we should bring her in?
Yes.
Okay. Thank you.
It makes me definitely appreciate the fragility of life and how somebody can be perfectly healthy, whole life ahead, and in an instant lose everything.
Who does that? Who does that? What kind of person just does that? Just randomly just shoots people.
I need a Motrin and some water.
Is this Willie?
belly?
I think I am.
39-year-old male motorcyclist hit from a vehicle. His motorcycle was totaled. He was wearing a helmet. He was complaining of all over body pain.
So there's going to be a lot of things going on. I need you to stay laying down. We want to make sure you don't have any more serious injuries, okay?
All right, I just wanted to not let all the women in here see my package.
All right, well, I hear you. We will cover you up as best we can, okay? Let's take a look at the rest of your body first, okay? And then we'll make you beautiful again.
Oh, you're so beautiful. Wow. That was so nice of you. Oh, and I got a bunch of money in my sock.
Okay, she's got it.
All right.
Don't worry.
Primary survey, airways intact.
Ow!
Where did that hurt when I pushed on your pelvis?
Everywhere.
Okay.
Was that your belly that hurt? All right, let's roll you. Get you off this point.
Oh, hell yeah.
Don't move. Let us.
But can you cover my ass, please?
We're about to. We just got to check first for any injuries.
Oh, hell no.
You're going to get an IV poke on your arm here.
Why?
Draw some blood work and you're gonna go first.
No, you draw blood work for what? Nobody's getting my blood DNA. Ow! You're hitting the wrong vein. Stop it!
You're doing okay.
You're going in my veins.
After an accident, you get a big adrenaline rush, and you could have a more serious injury than you think you do.
I hate needles.
I don't blame you. If you like needles, you'd have bigger problems. Even though he seems okay, and he's got a good sense of humor about things, we still don't know if he has another injury. So from here, sir, you're going to go to a CT scan. They're going to send you through the donut of truth. All your images look okay.
Yeah.
I still think you hurt your head pretty bad.
Yeah, I need a couple of stitches, so they say.
Good. We'll sew you up and get you looking handsome again, and then hopefully we'll be able to take this collar off.
That works great.
Right. Don't be in a rush, though. Take your time, rest here.
If you like me, you twist up at the bar, because where I'm from, highly respected like a star. The chicks, they did me because the way I ride the beat. You heard?
Ambulance 5 Boston.
Boston 85.
5 response to hockey rink. Injured hockey player. Respiratory difficulties after a puck to the neck.
85, we have the hockey rink.
Are they here or are they 4 minutes out now? 18-year-old hockey puck to the neck with expanding swelling and respiratory difficulty.
Oh, boy. Gentleman was playing ice hockey, took a slap shot to the anterior neck. Immediately, he skated off the ice, said he was having some difficulty breathing, which increased over time.
So tell me, does it feel like your throat is closing in on you? Yes. Is it hard to breathe right now? Yes.
Because it hurts to talk or you just can't?
I can't.
The guy's in rough shape. With a hockey puck to the neck, and it's interfering with his ability to speak.
I would not intubate him at this point in time. We're going to do a fiber optic bronchoscopy. He's a CTA of his neck.
Breathe in through your nose. Yeah, one more time, honey. Okay, I know it hurts. I know. Okay.
All right, X-ray.
I mean, I just panicked, not knowing what happened. All kinds of crazy things went through my mind. I have to say, it was one of the scariest moments of my life.
Ooh, look how narrow this is. Look at how narrow the air tube is, the light tube. That means there's swelling in the airway and it's starting to close.
This is a very, very serious situation.
On his chest X-ray, it's maybe 1 or 2 millimeters open.
Airway narrows way down right below the cords. That's concerning.
Yeah.
Paramedic 16 and ambulance 4. Female pedestrian struck at Mass Ave.
Alright, 6 we have the pedestrian struck.
8-4.
8-4, we have it. We're en route.
My leg! Oh, God!
Like she was in a crosswalk, car jumped the median, and you can see the indentation.
Oh, my leg!
All right. When I turned around, I saw him up there and she right there screaming.
You put a huge dent in the windshield. Okay, you got hit by a car. Okay, so we're going to do everything we need to make sure you can continue doing everything, okay?
My legs. I can't feel my legs.
Okay.
Oh, God! I have meatballs in my oven cooking.
You have meatballs in your oven?
Yeah.
All right.
Cooking.
Is anybody at home?
No.
No? Okay.
I wish you knew your husband's number so I could tell him to get home.
He's too far.
Then call your husband. Your husband has their number.
So this woman's got a broken leg, possibly internal injuries, and we really need to get her to the hospital as quickly as possible.
She is 5'4".
She's 5'4".
She had no.
Kindergarten 1?
She's in pain.
She got food in the stove. Why don't we get the child first and then worry about the stove?
It's just an abrasion. It's not open. The bone's still in. But this one's starting to get like it's compartmentalized. I'm sorry. All done.
I have meatballs in the oven.
Yeah, we got that. You're okay, all right? Everything's working out.
BNC, right, Raj?
Yes, sir.
So we have a 40-year-old female coming in. She's a pedestrian struck. Off the top of my head, we think of blunt trauma. She may have some internal bleeding, broken bones, or a closed head injury, so we'll do our trauma eval and see what's going on.
Where's my daughter?
Somebody pick your daughter up. Your daughter's here, okay? First of all, her daughter was at the bus stop, so she had to be picked up and someone brought her to the scene when we transported her to the hospital.
The meatballs in the oven.
See you later, buddy.
My meatballs in the oven.
And then she had an oven full of meatballs that had to be taken care of. So the Boston police went up to her apartment, shut off the meatballs, made them secure, and took care of that problem. And we transported her here and took care of that problem. So there were multifaceted problems that were taken care of in that one instance.
So this guy who was struck in the neck with a hockey puck, right there at the voice box, his neck right here, it should be about a finger's width all the way up. Instead, right here, it gets very, very narrow, which is why he's having trouble breathing.
Yeah, I'm not sure he's intubated, but we gotta watch it like a hawk.
Would you agree with giving steroids for him?
Absolutely. Let's give him some steroids.
Okay.
Oh my God, I was so worried.
Coach said I got hit. Cut.
And as Mark turned the puck right there.
The voice box here, it may have been broken by the hockey puck. His situation is what we call very critical, meaning it's a very high-risk injury in a high-risk area.
We're concerned that his larynx, his voice box might be injured, which runs the risk of him suddenly losing his ability to breathe. So we're watching him very closely and seeing if he needs to go to the operating room to have that repaired or not. And the throat surgeons are here looking at him and keeping an eye on him.
If you feel like your breathing is getting worse, you're going to let us know right away, okay? What should I do if it gets worse? Someone's going to be with you all the time.
We're not going to leave you alone.
Yeah, you're
We're not going to leave you alone. Okay?
You're not going to be alone for the next 12 hours minimum.
My meatballs in the oven.
Jenny was struck by a motor vehicle right up the street on Mass Ave. The motor vehicle actually kept going another 50 feet. One side of the windshield was all paved in. The worst of it seems to be, we think, closed bilateral tip fractures.
Are Dr. Matthews okay?
Okay.
What's hurting you the most?
My legs.
Your legs. Both of your legs?
Both of my legs.
Okay.
Did anybody turn off my meatballs in the oven?
Yes, actually, someone did turn off your meatballs in the oven. Okay?
Jenny, can you wiggle your right toes for me? Good, thank you.
How bad's your pain right now? 0 to 10 hours.
10.
10 out of 10 pain.
Can we get another 50 of fentanyl? Both of her bones in her lower legs look very broken.
We are also concerned that her fractures may result in damage to her muscles, nerves, and the vessels in her legs.
Give yourself a nice big hug. Listen, when we roll you, I'm gonna feel down your back, okay? And I want you to say yes or no if you feel pain. 1, 2, 3. Ah! Don't move your head. Don't move your head. Ah! Ah! Yes or no?
No.
Okay.
I mean, it hurts, but it's not like I'm gonna yell.
It doesn't seem like she has any spine damage. She is able to wiggle her toes, and she does have sensation in her lower extremities.
All right, quick x-ray, okay? I'm worried about compartment syndrome in her right leg. Compartment syndrome means that when your legs get so swollen from an injury that sometimes actually your nerves and your blood vessels can get damaged. I'm so happy you're alive.
Thank you. So am I.
All right, let's get you to CAT scan, okay? She will definitely need surgery.
For a compartment syndrome, the pressure will kill the muscle and the nerve tissue in her leg, and then that's irreversible. So essentially they have a foot, an ankle, and leg that they can't really move.
All I can think about is my daughter.
We only have 6 hours before there's irreversible damage. You never really know when the clock starts ticking. Ken, ready? So this lady is hit by a car, has bilateral tibia fractures, the leg bones below her knees. On the right side, she has a lot of swelling in the leg, which is causing pressure on the muscle, and that's an emergency to save her limb. So our goal is to get her recovered and get her back to her little girl. Sounds like we're going to do it. All right. So this is the incision we're going to make to what's called the fascia, the tissue that lines the muscle. That muscle's all alive and healthy. If we waited too long, the muscle would all die.
While I was working, an ambulance got called. I thought she had the baby with her first when she got hit, and then it really started going a little crazy, anxious to get here. Make sure she was okay.
That Pay me the big bucks. Did you see that? 4 more green greens. That's why you should be playing with Tinker Toys before you become an orthopedic surgeon. All right, we're good. So everything went fine. We did the fasciotomy, relieved the pressure on the muscle. All the muscle looked healthy. We have both fractures stabilized. You know, I think her prognosis overall is pretty good.
You throw me around like a piece of paper.
Hi. Why did you come to see me today?
Well, they made me go.
They did?
I had to go to the John.
Yep.
And I couldn't get up.
And that's what both of her knees buckled.
And why I end up in this place, I don't know.
As soon as we sat her down, she got nauseous and vomited a little bit.
When you were on the toilet, did you have chest pain?
No chest pain.
Did you feel like you were going to pass out?
Yes, or lightheaded.
Okay.
I suffer from sciatica.
Yeah?
And my back was killing me.
Oh, my goodness.
And I didn't sleep.
Okay.
And I haven't worn real makeup in 2 or 3 days.
There are very few women like you and I that can get away with no makeup.
Why don't you put a little powder on or something? Be a cute guy walking around.
There might be.
And you're not married? No.
My name's Dr. Choa, one of the residents working
here. Come closer. That Chowa.
Mm-hmm.
What kind of name is Chowa?
Choa's from Zambia.
I never met anyone from Zambia.
Mm-hmm.
Isn't that great? And I'm 85, so don't knock yourself out. Honey.
Okay. Any pain down here?
No.
Here?
There.
Here. So a lot of things going on, but I think it's probably her sciatica, which made her knees buckle when she was on the toilet.
Just let me stand for a sec.
Yep.
She's definitely a headstrong woman, and I have a concern that she would fall.
Oh, I'm sorry, dear.
That's okay. She is definitely not safe to go home.
They want to send me to rehab, and I'm not going.
I don't want you to come back with a broken hip.
I don't want to come back at all.
Yeah.
I'm going back to my 2-room apartment.
She doesn't want to go to a rehab facility, and I don't blame her. But at the same time, we have to do what's safe for her.
May I say thank you for everything you've done for me? I appreciate it.
You're going to be fine.
And
okay.
I love your hair.
Thank you.
And marry a nice fellow and have a lot of children.
Thank you very much.
You can do both. You can be a doctor and a mother and anything else you want to
I
be.
appreciate that.
Women.
Yeah, go women. Woo!
Bye.
She's a trip.
He's going to visit our friend. He's got a puck to his neck, so he's going to check on him. So hopefully he's doing all right.
Our patient who got hit in the neck with a hockey puck is doing much, much better. Looks like the steroids helped a lot. Help reduce the swelling.
What? It's straight on there? Yeah. There's a camera that just stuck down my nose and down the back of my
Were you
throat.
awake for that?
Yeah, it's horrible. And I was like gagging. It was so bad.
Do you need anything?
No, it should be good.
Glad you're feeling good.
Sleep.
See you. See you, Mark.
We all love each other. And we spend every day together, so it's like a family. We're like brothers now.
Now that I know he's going to be all right, I'm going to go home and take care of my other 2 boys. And try to talk them out of playing hockey.
We got to get somebody to come and give you a pedicure.
How are you feeling pain-wise?
Pain is probably like a 5.
So I'm excited to hear that my patient who was concerned about her meatballs, her legs are healing and she's heading out.
When that car was coming at me, when I saw that, this guy wasn't going to stop, I just said, my God, I'm going to die. Please take care of my baby. She wasn't a planned pregnancy. She wasn't a mistake. So the way I look at it, she was my gift. She was my surprise, and a very good surprise.
All of them? You got another big one at the house.
I left that for the nurse.
I feel blessed just to have her in my life. Vera and my daughter. I didn't really know until I got here about the meatballs. She said the police went and turned them off. They were a little dry, but gave them to my mother-in-law.
So the good news is that Jenny will be going to rehab. We're lucky that we were able to save her legs, and hopefully she'll continue to do well.
Off to therapy. I'll be back when I can walk.
Take care.
I love you all. Thank you.
Bye, everybody. I want to thank this guy with the muscles. Thank you. How many hours do you work a day?
12.
Oh, you must be rich.
No, hardly.
She's somebody that she'll remember. It makes it a good day.
your boy Dub, man, a.k.a. Willie Hamilton Jr. I'm a rapper, album coming out. To all motorcycle riders, I would say, be careful, because I almost lost my life. And I must say, it's good to be alive. It's a beautiful day to be alive. I was born to live, not born to die. I'm telling the truth, this ain't no lie. I'm from Beantown, hey, what you say? I'm from Beantown, hey, what you say?
Yeah, sunrise brings us paradise.
Lift your hands to the sky. Lift your hands up. What you gonna do? It don't stop shining on. Hey, your head's in the clouds while you're trying to break on through. Hey, waiting for the sun. What you gonna do?
I heard 3 cracks. Then I fell.
On the next Save My Life.
She fell 25 feet.
There is blood behind her eardrums.
She's deaf in her left ear.
You're not complaining like you're complaining.
Honey, don't call me honey.
All right.
Jason just took off. There was a truck coming the other way.
Don't move, man.
Right now, the primary concern is stopping the bleeding and saving his life.
And don't miss the series premiere of Boston EMS, Saturday at 9, 8 Central.
The Bachelorette with the men she sent home. The Men Tell All tomorrow night.
The Whispers, all new Monday on ABC.